right. Thank you everyone for joining us. Today we are going to do a review of how to QC a TMF document. And then if we have time, I have a whole bunch of sample documents that we can pull up and kind of do what we did before where we, kind of discuss it. Like this is a great way for you to test your knowledge. And if you're watching this video later, feel free to pause it. Like if I open up a document, you can pause it and think like, what is this document? Like, how does it interplay with other documents? And then also, if there's something wrong with this document, like look out for what you think could be an error on the document. Because we do try to show you documents that might have an error on it so that you can test your knowledge as though you had just gotten a new TMF job and this is your first day and you're looking at these documents, then trying to remember what they are and what you're looking for in the document. All right, let's get started. Okay, what have we learned so far about QCing? Does anyone want to jump in and show me? Maybe Ken, do you want to tell me what you've learned so far? What are the things you look for in a document?
So far, what I have learned is, I think the very first document that I should look for is the FDA Form 1572. From there, I can learn who's the PI, who's the sub-I, and what address is, some information like that.
Awesome, thank you. Great QC fact for us. Okay, so maybe I'll just hide my face down there. All right, what is quality control? This is just going to be kind of some overview here. We talk about QCing. QCing means quality control, and you're verifying and maintaining just a high level of quality for the documents. And then we do this to prepare for an inspection, which is when an agency such as like the FDA will come in and want to review the documents prior to approving, right? They're approving the ability for the company to sell the medication, and you're basically helping run the study that is testing out whether the medication is good. So why do we need TMF QC? And so this is to confirm that the TMF meets the requirements. And so we want to make sure that there's nothing missing from the document. So as Ken mentioned, there's a 1572, and that should be signed by the PI. And if he didn't sign it, that's not a good thing. And you want to catch that, right? You want to be able to say, hey, study team, I actually noticed the 1572 isn't signed. And they'll be like, oh my goodness, we'll get it signed. Or they'll give him a new version and he'll sign that. And that way the TMF is always having accurate documents that are basically, you want to be inspection ready at all times. All right, good clinical practices. That's Alcoa CA. This could be a question if you were being interviewed. What does Alcoa stand for? Attributable, legible, contemporaneous, which means like timely, original, accurate, and complete. So these are all things that you'd want to know as you get ready for your first TMF job or your TMF interview. Okay, so here are a couple things that we would like to we mentioned as steps for a QC. As we mentioned, is the document legible? Are all the pages included? Are there any signatures missing, as I just mentioned, where a PI should sign that 1572? Is the date correct? Especially when you're comparing against the metadata in the system. So either you are entering in the data or you are just comparing to the system. And we have some great videos from a company that lent us their videos so that we can look at some system tutorials. So we're going to go over that probably next week. And so some other items are you check the document title within the system, right? Because you are trying to make sure that it gets classified in the right spot. We talked about linking documents before, and then checking if a document's expired, right? You can mention and help the study team catch that and collect new documents. And then we talked about monitoring reports and how important they are. Does anyone want to tell me what do you expect with a monitoring report? What other 2 documents would you look for if you had a monitoring report and you're trying to make sure it's a complete packet? Jesse, go. I already picked on Ken. Go, Jesse. And it's okay if you don't know. Let me know. I have a hint too. If you need a hint, let me know, Jesse.
I need a hint.
Okay. So so I mentioned already there's 2 documents you're looking for. If you're looking at a monitoring report, there's 2 like accompanying documents, and they should like occur around the same time, and that's how you can check to make sure they're the same. And they are letters.
Okay, so it's the follow-up letter and the confirmation letter.
Good job. All right. Good. Thank you guys for being interactive. I know I'm calling on you, but we're gonna make this more interactive. Okay. Okay. Perfect. So this is the Viva etmf home screen. We talked about this just to make sure you guys are a little bit familiar with this. As I mentioned, we have some great videos, and we'll go over those, and those will kind of walk you through some items. And if you want to do anything before that, you can check out our previous video where we did walk you through some screenshots. But next time we will watch some videos that kind of give you a little bit more of a live tutorial. So then this goes to show you some different items, and so you can see the different documents. You can see the status over here. This is the gear wheel, which has changed. You can have different views, and then you can have different filters over here. So just a little refresher on the system. And then just to show you what I mentioned when you're checking, like you're checking the title and you're checking kind of the classification, has this document been filed in the correct spot? You will want to use that. That's what the name. And then there's all the different, the type, the subtype, the classification. And then, so this is what we call the metadata section, right? And then you're using the document to enter in the data. If you're QCing a document, so let's say you work at a company and somebody else is uploading the document, you're usually just checking the data. Does this data here on the right, which has been entered, match the document, right? Is this a protocol amendment too? You look, okay, protocol amendment signature page, and then there's the signature aspect, right? So that way you're checking, did they title the document correctly? Okay, and that's just an example, because I know we don't work in the system a lot in these different like webinars, and so I wanted to highlight what it looks like to be in the system. Okay, and then there's some basic stuff in terms of how to contact us on our Twitter, which I don't know if anyone's ever used, but we should all get on our Twitter. Let's look at some documents. Okay, actually, you know what? Let's look at this one first. Let's see if this works. All right, get ready for some questions, guys. Does anyone want to tell me what I'm looking at?
Financial disclosure.
Yeah, good job. It's a financial disclosure form. And what's important about it, Nick? What is it? What does it tell us?
It's going to tell us if the PI has any financial interest in whatever study that is.
Yep. And then you can see here that there's this box is like kind of not super checked. But so, you know, that's something that you could see wrong with this document. Anything else that you would look for? Anyone can speak up, because you want to make sure that you have the signature and the date and that the boxes are checked.
Excuse me, this one is the same as the FDF?
Yes, the FDS is a financial disclosure form.
But this is different.
Yes, so, and that's a really good point, thank you. So something to note is that, let's see what we're, I'll put this back here. So something to note is that a lot of times these documents they can be company specific, in the sense that they're created by the company, where they can look different, right? So the different regulatory boards say you have to have this, but they don't always, like the 1572 is standard because it's issued by the FDA, and you'll always see a 1572 looking like a 1572. A lot of other documents will look different. So PPD is a CRO. So PPD, this is their financial disclosure form, and they're calling it a clinical investigator financial certification. So that's something to note, is that documents might have very slight titles that are different, but they're basically the same thing. So that's why it's really good to like review the document and understand what it is. I'm pretty sure, for example, these questions here are probably pretty standard, like the 4 questions being asked, but maybe a company wants to add one. But in general, how the design and the layout, like the template can be different. And that's something to be really aware of, so that if you see something that looks a little different, it doesn't mean that it's wrong. You want to just read the document to get an understanding of what it is.
Thank
But
you.
yeah, great point to bring up.
Thank you.
Okay, let's see. Maybe we'll have Nick chime in on this one too. Does anyone know what this is?
Oh, 5-step.
And in general, yeah, you can always read the title. That helps. But does anyone know what this document is? What you would do with this document? How does this document help you QC a TMF, especially for like completeness?
Is it a delegation log?
So this is very similar. That's a great. This is very similar. It looks really similar. This is a training log. So, for example, this is specifically for an SIV, which is a site initiation visit. And that's a good thing we can go over this. I don't think we've talked much about this. This is the first visit for a site, and it's usually done by the monitor, but it's unique because it's the first one. They do this training. They're going to try to train as many people as they can. And instead of usually when the monitor comes out, they usually are checking in with just a study coordinator, and they are, it's mainly just a monitor directly working with the site, and the sponsor is not as involved. Whereas an SIV is the first visit and the sponsor is typically more involved. And this is the visit where they educate the clinical team at the site about what the study is. This is when, ideally they've already read the protocol and they're aware, okay, we're joining this study, we know what it's about. But this is where the sponsor and the monitor go out and they really talk and educate and make sure that the site is fully aware of anything that they could possibly want to know about the study. So they might cover, for example, like, okay, the lab. That's something that we haven't talked a lot about. There's lab samples that get collected, and how often they get collected, and what and how they send it, what it looks like, is something that gets covered a lot of times during an SIV. Because if they mess up the lab samples, it's a pretty big deal, and a lot of times it's pretty complex. So usually I'm going to dive into a little different aspects. I think that would kind of highlight some aspects that might be useful also for like Jesse and Nick, who have advanced on beyond the basic TMF knowledge. So it's good to get an idea of how things interact with each other. So the way it usually works is there's a lab kit. And so there's like a box that comes, and it's and they'll be like labeled and barcoded, and they'll open that kit for a patient visit. So a patient will come in, and let's say they maybe see the doctor, and they have and it's not like, a checkup, but they maybe like check in with the doctor, and they might see them if needed, like and then maybe the study coordinator does additional things, like the study coordinator might have them walk down the hallway and see how they're walking if the study is related to like gait or like muscle mass for walking, so they can run any like additional tests. And then a lot of times they'll make sure that they also have their lab samples if that is needed in the schedule of events. Schedule of events is like a big chart that's in the protocol, and that tells you what's coming in at what time. And I'll see if I have one handy. So this is the protocol. Usually they have a mini protocol. And even when you make mini protocols, it's kind of hard to see, they usually have little cheat sheets because it's so much information to know. So in this training, right, we were looking at a training log, and it's for an SIV where they're introducing the protocol and making sure that the site team has no questions, they include and they go over all these specific details, right? So as you can see, this little document, and it's pretty small print, it's 102 pages, right? It's small, but it's pretty dense. It's got a lot of information. And then you'll have sometimes just like an information card that gives you that the study coordinators will keep, so they understand what's going on at what time. And then like, okay, so then here is, I don't think you're gonna be able to see it with the light, but there's a schedule of events, the big chart, and it shows, yeah, I don't think you can see, there's like little lines, where's my finger? There's little lines, those are all the different things going on. And then across the top, it's all these different, like, it's like a timing, right? So it's like what needs to be done and at what time. And there's usually little X's all over the place. So it's really complicated. So the point I'm trying to make is that the SIV is where a training occurs to make sure that the site is ready. And this is an example of a log where they're trying to document everyone who's on there and try to get them all this information about the actual study. This is a really important time for anyone to ask questions, right? Because basically after this moment, the site is like now responsible to do things. And this is a time for them to be trained on it. And you can see that there's two different signatures. Now, if you had to guess, and this could be a question for Keith, Jesse, and Nick, well, who do you think the trainer is? Like, what role do you think they play? Who could be a trainer?
The PI.
In this case, the PI is getting trained right there. See, the PI is that first one, which is important. You want to make sure the PI gets trained. Any other guess?
Yeah, this is going to be like the medical monitor, the CTM on the study.
Yep, so medical monitor, CTM, and usually the monitor sometimes will help out too. Usually it's more on the sponsor side, but the monitor can, like if there's maybe they'll go over the schedule of events or something. The medical monitor should usually go over like the safety aspect. And the CTM, who's the clinical trial manager, right? So they're responsible for kind of just running the study. And they're all going to just do any other segments, right? They might go over inclusion criteria, like we talked about. I've done something similar to an SIV, and I had to go over like the lab samples. Ours was a refresher in a sense, kind of like a mini investigator meeting, because people were really confused. People were doing things wrong, costing us lots of money to the lab. You know, there was all these different tubes, and they were collecting the different things and putting it in the wrong tube, and it was just it was a huge mess. And so give me one moment here. So let me see. All right, thank you for bearing with me. Hopefully they can slice that. But basically, yeah, so everyone's presenting on different aspects. Clinical studies are complicated, and that's why it's really important that people attend these trainings. And it's the sponsor's responsibility for making sure that the site is fully trained. You also want to watch out for site turnover. If there are study coordinators that are leaving constantly, that means that the monitor needs to do a really good job of going out there and retraining them constantly and making sure that they fully understand what's going on. The study coordinator role is a critical role in this whole process, right? They do a lot of the work, and they get paid probably the least out of everybody involved. They make the least, and so it's a really interesting dynamic. Sometimes, a lot of times, like they can be like pre-college or like post-college pre-medical students, or sometimes they're nurses too. But it's a really busy role, and you do a lot, you don't get paid a lot. And so as a result, people leave a lot. It's kind of, let's say, like a TMF, where it can be a really good stepping point into going into working for the sponsor. And so as a result, there is heavy turnover, and they're pretty critical. Like if somebody's new and they don't know what's going on, it can be pretty difficult, and things can go wrong, right? And so that's the role of the monitor, is to make sure things are going right at the site, and they report back to the sponsor, right? Which we mentioned, the medical monitor, CTM, that's a sponsor company. And yeah, you also want to check the dates, make sure people actually signed. Anything, do you see anything missing out of this guy?
Yes, page 2 of rank.
Page 2. Oh, so a lot of times, that's a good catch, Ken. A lot of the times there are documents that are like one and done. So like the 1572, it can be updated, but if it gets updated, they do a new one and they sign it. A lot of times, like logs though, you will make multiple. So this one says one of, because it's not done yet. It's not been collected yet. But that's a good catch. You do want to look for anything. Are there any other blanks somebody would notice?
Site number?
Yes, the site number is empty. There should be a site number there. Oops, okay. So we just have a few more minutes. Maybe we'll do one more document, if you guys are down for that. Let's do an IP shipment, because I don't feel like we've talked about that all that much. Anyone, like, let's say Ken or Rachel, would you tell me what this document is?
It's like a supply chain.
Okay, so this is, yeah, investigational product shipment form. So this is the document that they're basically requesting. They're requesting things to be sent out. So this is a very simple method. This won't be very common. You won't see this that often. But basically, this is from a vendor. And then it gets signed by the clinical trial assistant is the one who's filling this out. They maybe got a request from the site, and then they send it to Catalent, which is a vendor that handles the shipment of the drug. And then this down here, the acknowledgement of receipt, is when it gets sent to the site. They are to fill this out, and then they send it back. So this is a good example of when you see things that are blank, it doesn't always mean it's wrong or it has to be filled in. It should get your attention, and you should investigate why it's blank. But you see here, acknowledgement of receipt. Now, in general, you wouldn't file this in the TMF until it's done. So if you got this and you see it in the TMF, it should be signed. But for example, if it's just a document on someone's desk or whatever, that means it hasn't gotten to the site yet. So yeah, so that's that document.
Would you use a percentage, like write down like 80% percentage complete if you don't have that document returned?
Yeah, so that's a great question. And typically you would just flag it as like missing section. Right. In this case, so you could say like missing signature or missing and an aspect of it. You wouldn't have to. You would just say missing. You wouldn't have to say like a percentage of it is missing.
Okay.
Yeah. No, that's a great question though. Okay, hold on one moment. I think we are good. If anyone has any questions, feel free to email me, reach out to me. And then on Friday, we're going to dive a little bit deeper into the CTA role and go over just some things that I've done as a CTA in my past. It's definitely very different per company of what the CTA role is. But I think just even showing some examples of things you could do for as a CTA will be helpful. And I kind of think it also helps you picture the different documents and the overall process of clinical research and where different roles fit in. So yeah, sounds great, everybody. Thank you for joining. Have a
Thank
nice
you so much.
evening.
Thank you.
Bye.
Bye-bye.
Bye.